Morning, everyone, and welcome to our Chamber Community COVID-19 call. I'm Bill Miles with the Hilton Head Island-Bluffton Chamber of Commerce, and we're delighted to have you joining us again this morning. As always, our goal remains to convene, convey, and connect our community with leadership across all sectors for real-time, unfiltered information. Every week, every day, and in some cases, every hour brings forth changes and new information as it relates to the COVID-19 crisis. We continue to believe that facts over fear is one of the most critical things we need to focus on as a community, state, and nation, as we're bombarded daily with information and more than our fair share of misinformation via social media and other outlets. I'm so appreciative by the way our community continues to come together, and I encourage everyone to focus on the positive. We're beyond blessed in the Low Country, and we're all working toward that same goal, the health and safety of our residents, physically, emotionally, and economically. All of us have an important responsibility to act with common sense, cool heads, and to work together. We're far stronger when we work together, and it's incredible the way our residents are supporting one another. When you look at this issue from 40,000 feet, what's important to business is important to Low Country lives and communities. Our goal is to get our economy up and running as quickly as possible so that residents can feed their families, get back to work, keep our business community healthy, and moving toward recovery. Your chamber has a tourism recovery marketing plan in place and ready to implement when the time is right. And please note, I said when the time is right. Today, we'll be releasing a video on our chamber social media outlets, as well as our destination social media, letting everyone know that residents matter, community matters. When the time is right, we look forward to welcoming our guests back. Just as we have done in our previous town halls, we've asked each of our speakers to give a 3 to 5 minute briefing on what's happening in their sector, followed by questions. To get things started this morning, we're pleased and honored to have United States Senator Tim Scott joining our call. Senator Scott, we know that you've been a busy man. We appreciate you out there fighting for business and small business, and we look forward to having an update from you this morning. Ladies and gentlemen, Tim Scott. Senator Scott, I believe you're on mute. If we could just unmute you, I think we'll be ready to go. Press *6 if you would, please. Senators, press *6 and we'll have you ready to go. Okay, Senator, while we continue to try and connect you, I apologize for the connectivity issues. Please stay with us. We're going to move on just as we try and connect you to Lieutenant Governor Pamela Evett. Pamela, Lieutenant Governor, are you with us this morning?
Yes, I am.
Great. Good morning, and thank you for joining us.
Good morning, and thank you for having me. And everybody, thank you for joining in. It's very important, like you said, to get good and accurate information. As the governor has said, thank you to everybody who is following our distancing directive. That is so very important here in flattening the curve and keeping all South Carolinians safe. We have some great things I want to share with you. By directive of the governor, he had asked me to work with Commerce to come up with a business website. It was very important for him to show businesses in South Carolina we were constantly thinking about them and their needs. And so we developed a page on Commerce's website. So if you go to Commerce's website, or if you want to tell businesses that you know that are looking for information, this is a great resource center. You go to www.sccommerce.com. There'll be an orange box in the middle of the screen. It says COVID-19 Resource Center. And what we have done is we have taken all the links from any of our government agencies that would be imperative for somebody to have information from, and we put it all on one page. So we're not hunting around, looking around. The governor was very clear in his directive. He wanted to make sure things were written in easy to understand language, nothing too wordy. He didn't want to put more stress on businesses by having to try to read and decipher things that maybe they're not familiar with. So I went to all of our departments and said, hey, can you give me the 5 or 6 most frequently asked questions and the answers to those questions? We felt that this would be good for them and their call centers to have a lot of repetitive questions answered quickly for our businesses. We made sure we have things on there like unemployment, the links, what's happening there, the forgiveness at the end of the year with people's mod rates during this time of having to lay people off and furlough their employees. We wanted to make sure we had all the information from Department of Revenue, which taxes had been furloughed to June 1st. We made sure that we put the latest updates that we have furloughed corporate and individual income tax to July 15th to stay in line with our federal government. We have all the governor's executive orders. We have links to the CARE Act along with great PowerPoints and tutorials about what's available in the CARE Act. We have an SBA link so that people can find out if they're eligible for the SBA and how to go about filling out all the proper paperwork, what they would need. So I encourage all businesses to go to that site. I'd like to also remind everybody that the census started April 1st. April 1st was the kickoff. We didn't do it with all the fanfare and glitz that we had hoped with our local and our statewide partners, unfortunately, because of this COVID-19 time. However, it is so very important. There is $657 billion eligible to go to states, $900 billion if you're talking about monies that will go to localities and the state. That are all tied to our census numbers. So you can see the importance of making sure that we spread the word. It all begins with each one of us to make sure that all of our friends, family, everybody we know is filling out their census information. It's so much easier than it's ever has been. You can go on to www.census.gov. It literally takes a few minutes. It's the first time since the census that we've been able to do this electronically, which is great considering the time that we're in. We just have to get people to do that. Monies that will be being distributed to our state from the federal government because of this pandemic that we're in are being calculated based on our 2010 numbers that were submitted. And we know that we are upwards of 20% undercounted. I know when I was in Hilton Head, we talked a lot about infrastructure and public transportation. Money comes from the federal government on top of what we have available in the state based on these census numbers. So I hope I'm impressing upon everybody the importance of taking just literally a few minutes. I did it for my household. It took less than 5 minutes, but it's such a great impact for our state. As of the end of last week, we're only 34% counted. We're not at the bottom of the list, but we need to be number one. We need to make sure we get 100% counted so that South Carolina gets its fair share from the federal government so that we can get things done here in our state. Thank you all again so much for keeping social distancing first and foremost in our lives these days. Please continue to tune in to the governor and his press conferences where he will give all the latest information. And stay well, Hilton Head. I look forward to being back down there again really soon and look forward to any questions anyone may have.
Thank you so much for joining us this morning. There was one comment that I'll pass on, and being here on Hilton Head Island, Beaufort County, South Carolina, that there is hope that there will be a targeted relief bill for the travel and tourism industry. So just as you're working, and I'm sure working closely with Dwayne Parrish at SCPRT, please keep that in mind for the tourism industry here in South Carolina.
Well, thank you. You know, Dwayne, that is all he worries about. And we have a call every day through SCEMD. South Carolina is a little bit more fortunate than some states in the sense that we know how to connect and communicate with each other during times of uncertainty like this due to, you know, our experiences with hurricanes. So we have a call every day. Dwayne is on that call. He's updating us with all the numbers coming out of the hospitality industry. We are very concerned, and the governor is keeping our hospitality industry first and foremost in his mind. So thank you for that.
Thank you again, and thanks for joining us, and not only today, but always being so willing that whenever asked, you're always available, and we sincerely appreciate that. Have a good day. Thank you. We're going to move on now to, I believe, our connectivity issues with Senator Scott. We have him on the line, and sorry for the unmuting, Senator, but thank you for joining in today.
Good morning. Can you hear me?
Yes, sir, we do. Welcome,
Excellent.
Senator.
Well, thank you very much. I had no control over my mute button on this device, but it's good to hear your voice, and certainly good to participate in the conference call here. A lot of things going on, but perhaps most importantly, what's not going on next week is incredibly important, especially to the Hilton Head, Beaufort County area, and for the state of South Carolina. Major loss of revenue when heritage does not happen. So it does not go without saying that I am excited every time I have the chance to say Happy Heritage. This is a year where, unfortunately, that will not happen. So that even reminds me of the importance of filling the void that's going to be caused by a crater-sized hole that's caused by the loss of the income, the revenue stream that comes from heritage not happening this year. So that's something that we're going to have to spend some quality time thinking through as a state and, frankly, as a community. And please count me in as someone who will be a part of that conversation. As it relates to the CARES Act, a couple of very important points to note. PPP, the small business loan program that becomes a grant, has been basically out on the market for about 4 days, if you don't include Saturday and Sunday. Over $50 billion have already been loaned out to more than 178,000 businesses. There are certainly some kinks in the system, but it's not stopping a lot of folks from being able to achieve the goal of getting the resources. The biggest concerns that I continue to hear, I have a call today with the SBA administrator. I look forward to hearing some comments later on. The biggest concern that we have is that banks prioritize their relationships first. So if you have a relationship with whatever your financial institution is, that you're in the front of the line. And typically those institutions want you to have both a checking or saving relationship as well as a loan relationship. And so that's causing some confusion on where you go to get more assistance. I know that there's an SBA person going to speak later on in this call, so I won't go through those comments for them. The second thing I'd say is that the direct payments, a lot of questions about the direct payments, those will start hitting accounts as early as next week. So if you have direct deposit, it is the fastest way to get the $1,200 check if your income is under $75,000, household income for two folks under $150,000. That is the fastest way to get it. If you're looking for a paper check to come in the mail, that won't happen until as late as August. So there is some sense of urgency. The IRS.gov will have an opportunity for folks to sign up to get the direct deposit done. If you're a senior on Social Security, the good news is they will use the information they already have in order to process those checks, those seniors who are on the fixed income through Social Security. On the larger businesses, mid-size and up, the 500 plus, we are standing up a few commercial paper facilities that will have about $450 billion that converts into about $3 trillion of lending capacity for the mid-sized businesses and larger. That should be up and running as we speak now. We had a call yesterday on that, the progress that we're making there, which is good news. On the nonprofit front, there are a lot of nonprofits that are now eligible for the PPP program as well. Those folks have been greeted by their bankers and financial institutions typically favorably, and since we're talking about the payroll and not the mission of the nonprofits. So we've had to overcome those hurdles. The only other points I'd say is that the funds for the state and for the hospitals, about $150 billion being deployed, the minimum of $1.25 billion coming to states throughout this nation. Hospital funds, I spoke with major CEOs of the major hospitals in South Carolina yesterday, and all hospitals within the hospital association within the last 7 days. $117 billion earmarked for hospitals and healthcare workers, about 45 billion FEMA resources coming to bear, as well as 4.3 billion for the CDC and about $11 billion for vaccines. We are making progress. The good news is the curve seems to be flattening nationwide. Our concern as South Carolinians is that part of the flattening of the curve for us. Our apex or our peak is really late April, early May. So we have to remain diligent in following the social distancing guidelines, washing our hands, not touching our faces, coughing into the bin of the elbow. Those things will help us keep lives. We'll save lives by doing those things ourselves. But it is certainly, I think I'm optimistic about where we're going, and I am thankful that we are all in the same boat together. And I look forward to comments later on after everyone has spoken.
Thank you, Senator. One question we have for you from Mary. We are an ag business. It looks like we can't use idle funds. Any word if this might change? And we will be using the Triple P.
Great. Good to hear that part. Two things. Phase 4 will try to deal with some of the issues that we have. We had a call with ag earlier this week as well. I'm hopeful that we'll see some thawing of some of the challenges that we're seeing around that, as well as infrastructure needs that will be important to the island and Beaufort County specifically. The president has sent the signals. I meant to say this earlier, so I'm saying it now. The president has sent the signal that he's willing to work and negotiate with Speaker Pelosi on an infrastructure package to deal with our bridges and some of the challenges that we see throughout South Carolina and the nation.
Great, Senator. Thank you. We have another question. I have received my unemployment check, but it did not include the $600 reference from the stimulus package. Do you know when that will be available?
Well, my understanding is that the state signed the appropriate paperwork on March 28th. The good news is if you haven't received it, there certainly at due has been a bottleneck there without any question. The resources are coming to the state or should be perhaps being received by the state now. The good news is that the week ending April 4th, whether you've received it immediately or not, we will go ahead and include that week in your first $600 disbursement. So if you were unemployed on April 1st, then you will be receiving that $600 additional enhanced payment for that week and for the up to 16 weeks following. So the thought is that should be happening within the next 14 days. I'm not sure how long it takes for all of the machinery to work its way through, but the resources have been identified, tapped, and the resources are being sent to all the states.
We have another question, and that question comes from Brent. And Brent is asking if there will be any relief for 501c6 organizations in the next round of the CARES Act.
Yeah, I've spoken to. That's a great question. It's one of the part of the challenge of the 501c6s is so often we see them as quasi-governmental agencies, and so when we were going through the process in small business 501c3s, 501c19s, all which were veteran organizations, were all included in the Triple P. The challenge was that most often when you talk to folks who've not had local government experience, the C6 is an unusual hybrid of an organization that's trending towards being more independent and less government dependent on taxes and fees from the government. So that is a part of hopefully phase 4. It certainly is something that's been brought to my attention. I've worked with a number of C6s over the last 10 days trying to figure out how to get a fix in the system that was impossible after the ink had dried on the CARES Act first iteration of it. Hopefully the second iterations will see that included, and that's something that Dwayne Parrish, as well as Helen Hill and a number of other folks in the tourism-related industries have spoken to me about, and the economic development and chambers as well.
Thank you. One more question from Keith. And Keith is asking if there will be in the next round a way to fix so people aren't getting raises by going on unemployment.
That is, as you all may have watched my fight on well, probably you had more to do with your life than watch C-SPAN, but we had a robust discussion on the challenges around giving people a raise while they're unemployed. I had an amendment to fix it. It did not win. I lost 45 to 47 though it requires 60 votes for that amendment to have been adopted and included in the CARES Act. The problem is that so many of our states have antiquated unemployment systems, and the ability to be precise and give an employee who's now unemployed 100% of their compensation, which has actually never been done before as well. This time, we were not able to get that fix in there. So if you make less than $24 an hour, it is going to be beneficial from a financial perspective to stay on unemployment for too long. So we are going to work on that in phase 4. I'm not confident that it will be included. We will try again, certainly, but it's going to take states several months to actually get the resources necessary, which I'm willing to provide to states to fix their unemployment system. But that perverse incentive is it is something that I have real issues with. And myself, Senator Lindsey Graham, Ben Sass, and 3 others fought very hard on the floor to make progress on just giving people 100% of their income, not 150% of their income if you're making $15 to $20 an hour. So we lost that fight, but we'll fight again.
Senator, thank you. Terrific information today, as always. We appreciate your fight on behalf of South Carolina and America, and continue. I know you've got a heavy lift in front of you each and every day, and just know that this group on the telephone today really appreciates you and your leadership.
Thank you, sir. I'll listen on for a little while longer.
Great. Thank you, Senator.
Yes, sir.
Our next speaker this morning, we're going to focus on DHEC, and we're delighted to have Dr. Michael Kaka back with us for an update from DHEC. Dr. Kaka?
Thank you very much. Good morning, and thanks again for the opportunity to speak. So we reported 187 new cases of COVID-19 yesterday, which brings the total number of people confirmed to have the disease in South Carolina to 2,417. This includes 169 in Beaufort County, including 79 in the last week. We've also unfortunately had 51 deaths reported, including 4 in Beaufort County. Over the last week, we have seen an accelerated rate of infections in the state. An average of 187 new infections per day have been reported in the past week. This is an increase from the average of 90 new infections per day being reported the week prior. We recognize the hardships that many South Carolinians are facing as we face this public health threat together. I want to reassure the public that Team South Carolina is working hard with our local, state, and national partners to protect the health and safety of all South Carolinians. We continue to work with our healthcare facilities to stay updated on the availability of acute care beds throughout our state. Currently, we are at 51% capacity. A total of 23,680 tests have been performed both by DHEC's Public Health Laboratory and private laboratories in the state. 10% of those tests have come back positive for COVID-19 at this point. While our state's public health laboratory has no delays in testing currently, private laboratories across the nation have reported significant delays, which would indicate an even higher number of cases yet to be reported. We are working to avoid the problems that the most impacted areas are seeing related to stress on the healthcare system, including hospitalization rates, ventilator availability, and others. We are doing this by prioritizing the limited resources. Our current data shows that social distancing and staying home help combat the spread of the disease and ultimately save lives. However, while these hard-hit areas of the country are continuing to have significant daily mortality, it puts us in the best position to plan for the worst. The daily case counts in some of those areas is improving due to strong mitigation efforts. We've worked in consultation with the governor to implement effective measures to slow the spread of the virus. Our ability to combat this disease will depend on the actions we each take. This is a historic, unprecedented event. How we respond as individuals, a community, and a state will be remembered for generations to come. And we ask for your continued support by following the guidance of our public health professionals so that we can continue to fight on your behalf. Please do your part, stay at home, and limit your close contact with others. And for the latest information, please do visit our website, scdhec.gov/COVID-19. And I can take any questions at this time.
Thank you, Dr. Kaka. One question that we have is from Marty, and Marty is asking if the numbers, the COVID-19 numbers, is a rolling 14-day average, or how those are determined long term.
The numbers we're reporting out are the total average, the cumulative average over time.
Okay, thank you.
As far as the new cases reported.
Very good.
Perhaps he was referring to the averages that I gave that show the increase in cases. The averages I mentioned were the average for the past week compared to the week prior to that. That's what I was referring to in the averages.
Okay, thank you. That clarifies that. And thank you for that. We're gonna move on to the president of the South Carolina Nurses Association. We're delighted to have Dr. Kelly Buthelay with us this morning. Dr. Buthelay.
Hi, nice to be here. Thank you for the invitation. I'm very happy to be a part of this call. I'm especially glad to follow the information provided by DHEC because I think some of the information that he has provided us can help frame what I would like to, discuss today. I cannot underscore how important it is for us all to do our part. As a nurse practitioner in the community and the president of South Carolina Nurses Association, I am the voice of a collective voice of all of the registered nurses and the advanced practice nurses, and even the licensed practice, the LPNs, the licensed practical nurses in the state that are working extremely hard and diligently at patient sides in all kinds of facilities, hospitals, care centers, urgent care centers. They're in different settings working with patients, not knowing if they're being exposed and making do with all the PPE that they may or may not have. And we know that they're stretched and that they have limited resources. And our message is extremely clear. It's very simple. Everyone needs to heed to the orders to stay home. If you have an essential job, then you can go home and you can go to work. You can go to get food and medications or be a caregiver to someone, but we have to be steadfast in our commitment to do social distancing. We have to all do our part. I am a person that is never home, and it has been very difficult for me to work from home and to limit how much I do outside my home because I've had to change the way I practice. But we have to do this. This is just essential. We all have to wear masks, and I would like to touch on that as well. But we need to be very diligent in how we live our lives in this new normal for us. And we need to do it continuing through the end of April and maybe beginning of May. While we are seeing some good news across the country, maybe little glimmers of hope, that is not the time to say, oh, let's let our guard down. Let's get together with friends. We can't. We need to be steadfast. We need to be committed to making sure that we don't celebrate prematurely and relax and inadvertently spread the virus to someone unsuspecting. There are a lot of people that have underlying health conditions that we may not outwardly see that may be at higher risk, and we may unwittingly or unknowingly carry it ourselves without symptoms and spread it, and just that continues and repeats on and on. So one of the things that I'd really like to touch on is the issue of masks. I probably get this question on a daily basis about the efficacy of masks. At this point, it is imperative that the only people that use surgical or N95 or a medical mask are healthcare providers and clinicians. That is your paramedics and your EMTs, nurses, physicians, respiratory care providers, anyone that works in a health setting. We have to reserve those for those healthcare providers. For the lay public, we're talking you know, your general audience, a cashier at Harris Teeter, someone walking their dog, anyone else, they can use a homemade mask. And there's lots of ways that we can do this. Our Surgeon General made a mask in under a minute with rubber bands, ponytail ties, and a t-shirt. The idea is we're trying to just block a possibility of getting any kind of droplet in our face. Remember, it's not a pass to shorten the distance between you and someone else. It is a secondary strategy between us and the person that we may see in the grocery store or the pharmacy. We still keep the 6 feet social distancing, but we also have a mask because it's a combined strategy to help reduce the possibility of transmitting or contacting the virus. And that's just really important. Healthcare workers don't have enough masks, and we have to make sure that any that we have go to them that are medical masks, and that the rest of the public wear some sort of homemade masks. And I will tell you that I started a campaign for the local Hilton Head Fire and Rescue and got masks for them. And sewers out of the blue started sewing masks for patients and everyone else. So there are a ton of people out there sewing masks. So they're out there and they can be had. So all kinds of little masks are available. But the N95s and surgical masks have to go to our medical people. And when I'm out, I wear a homemade mask so I can go to the pharmacy and pick up medicine. So limit how often you're out, wear your mask, wash your hands, keep the social distancing, go enjoy some sunshine. Just because we can't see it doesn't mean it's not there. And I will take any calls.
Thank you, Dr. Buthelay. Question from Bill. Explain if and how the plexiglass barriers at stores are effective.
Well, my first thought is they're not. I was at Harris Teeter this weekend to get my, couple weeks of groceries, and they had a small plexiglass barrier, but unfortunately the cashier wasn't behind it. So that was the only place that I have gone. That was my one outing, and I haven't had the chance to see others. Unless the cashier is actually behind the plexiglass, it's not going to be effective. As a matter of fact, we talked to that cashier and wanted to talk to the manager, but they weren't around. But I did talk to my sewers, and they donated a bunch of masks for the Harris Teeter cashier. So if that'll be more effective than trying to stay behind a plexiglass barrier. If the barrier's not directly in front of them, it's not going to be helpful, because unless they're that 6 feet apart from the public, it's not effective. That's my opinion.
Dr. Buthelay, thank you. Thank you for the great work that you do, and the great work of the South Carolina Nurses Association. We appreciate you joining our call this morning.
Thank you for inviting me. I'll stay on the call in case there's any other questions.
Very good. Thank you. We'll be moving on now to Jeremy Clark, and Jeremy is the Market Chief Executive for Hilton Head Hospital. Welcome to the call, Jeremy.
Well, good morning, Bill. Can you hear me okay?
Yes, sir.
Excellent.
Good morning.
Good morning. Well, it's an honor to follow Dr. Buthelay, and I'll just reiterate her points on keeping the surgical mask, the N95s for healthcare workers, and I'll also echo her comments on the community. We've gotten so much support from people making masks. It's been really great to see. So I would absolutely echo her remarks. As I've reported in previous weeks, Hilton Head Regional Healthcare continues to operate effectively and safely. We continue to feel good about the plans that we have implemented, and also the ones that we have ready if needed. And I want to give you a little bit more detail on those plans today. Like many of you on this call, we've been watching the stories and images of patients and caregivers in hospitals across the country, and our hearts are going out to them. That is not the situation in our community today. So I want you to know that both Hilton Head Hospital and Coastal Carolina Hospital are using every day to prepare for what might come. We are meeting daily, reviewing the supplies that we have, reviewing our staffing. We're in direct communication with EMS officials, and we're implementing our plan. And as this situation evolves, our actions are evolving with it as well. You know, the most important resource we have are the colleagues and the physicians that we have here on our staff, and we're fortunate that we have such highly skilled individuals here in our organization. But right now, many of them are not as busy as they normally are during this time. So over the last couple of weeks, we've made great progress in cross-training many of these staff, really getting them ready so that if we see a surge of patients, they can assist in us taking care of them. So for example, we're getting our operating room nurses reacclimated to providing care on the floor. They're spending time, you know, getting back into the electronic medical records, spending time shoulder to shoulder with our med-surg nurses on the floor, really seeing what they do on a daily basis, again, so that if needed, they'll be ready. Similarly with physicians, we already have a great network of emergency room physicians in this community that we know that we can draw on if we need to. We also have a great pool of primary care physicians who have volunteered to assist us and take care of patients on the floors of the hospital and the units of the hospital if we're needed. We're also, again, getting great support from the community. We've had plenty of healthcare workers, retired nurses, physicians who have reached out to us offering to help. So we're keeping track of them, and I know that if we need them, they'll be ready for us. So I feel really good about the people that we have in our organization. Most of the questions I get relate to capacity. How would we be able to handle a surge of patients? What's our capacity? How many ventilators do we have? So I want you to know that today, the number of patients that we have in our health system is about half of what it normally is. And this is by design. So already we have more capacity, both beds and staff, available to us than we usually do. I also want you to understand that many hospitals, including ours, are able to, in an emergency, increase their capacity. So we can operate more beds than we are actually licensed for. We can operate more ventilators, or we can provide ventilator assistance to more patients than the actual number of ventilators that we have in-house. So both Hilton Head Hospital and Coastal Carolina Hospital have well-defined plans to expand our capacity to treat a surge of patients if we see that surge. That's true for our med-surg units, but it's also true for our high acuity, high level intensive care units as well. We have good plans in place, and we're already going through and practicing executing on those plans so that we'll be ready. A similar situation with ventilators. We'll be able to significantly increase our normal capacity to care for patients on ventilators by using other technology as well. So to summarize, both hospitals have more capacity today than we normally do, and both hospitals have the ability, with extra beds, extra staff, and extra technology, to provide care for even more patients should we see that surge arrive. I also get asked, well, what if we see more patients than that? What if there's a surge of patients that are more than you've prepared for? We've been in close communication with South Carolina Emergency Management Department. We've had the National Guard down here on site to evaluate space that we could use, looking at space mainly for a tier 1 lower level care. So they've been out. We've been coordinating those efforts with local emergency management officials and DHEC. So I feel really good about our ability to provide care both in the hospitals, but also outside the walls of the hospital if we need to. Finally, many of the people on this call have probably heard the term PPE, personal protective equipment, more than you ever had before. And that's because it's so important to us. I want you to know that, for us, this means the N95 mask, the surgical mask, face shields, isolation gowns, gloves, all of these things, which is how we keep our colleagues and our physicians safe. We review this inventory every single day. We look at how many days on hand that we have. If these were normal usage, we also look at how many days on hand we would have during an accelerated usage, which is what we would expect if we see a surge of patients. We continue to have an adequate supply. We're being safe in utilizing it, but we're also conserving it so that we can ensure that it lasts. We are continuing to place orders with our existing suppliers, and we are still receiving some shipments every week. but we're also working with new suppliers, and we've been really encouraged by the way they've stepped up. Some have changed the design of their products, but they're helping us out, and we've been really grateful of very appreciative of their assistance. So finally, we're also incredibly thankful for the support of the community, the donations that we received for masks and gloves and food, and lots of food, which our staff love. So we really appreciate that. So overall, I continue to feel prepared. I feel very good about our people, about their training, about our supplies, about our processes that we have in place, and the ones that we have in case we see that surge. I want you to know that every day we are focused. We are focused on taking care of the patients that we have in house. We're also focused on preparing to take care of the patients that may come in a surge. So appreciate the leadership that we see every day here locally, and also with our state leaders. And I really appreciate all the support that is coming from the community for our caregivers. So with that, Bill, I'll hand it back to you.
Jeremy, thank you for that very, very thorough update. And we had several questions for you. However, all those questions you obviously anticipated, and you have answered those already. So thank you for that. And thanks to the fine team you have in place. And just let them know that the entire community is saluting the work that each and every one of you are doing every day. So thank you, Jeremy.
Great. Thanks, Bill.
We'll transition now to Dwayne Parrish, who's the Director of South Carolina Parks, Recreation, and Tourism. Dwayne, thanks for joining our call again this week.
Thank you, Bill. Can you hear me okay?
Yes, sir.
Fantastic. I appreciate you taking the time doing these calls, and also I appreciate you giving me an opportunity to just give a quick update on the tourism industry. So as of yesterday, there were 452 hotels closed around the state. Over half of those are in the Grand Strand area that were closed by local ordinance. And I understand Hilton Head hotels will have to close as well, which will certainly increase that number today some. Of the hotels that are open around the state, occupancy is in the 10 to 15% range, with extended stay products such as Residence Inn and Candlewood Suites, along with short-term rentals, are faring slightly better than the standard hotel. Also, hotels along the interstates, particularly Interstate 95, are faring better than those in cities and metropolitan areas. A lot of our industry obviously has been laid off, furloughed, or terminated, if you will, because of the crisis. The Department of Employment and Workforce has been overwhelmed. I just wanted to pass along, they have hired more staff and more phone lines this week to help mitigate some of that. Obviously, the last week was a record number of people filed for unemployment. Many of those were within our industry, and while my hearts go out to them, we want to try to make it as easy and as quickly as possible to get paid. We've been working with our industry partners on taking advantage of the CARES Act stimulus, which Senator Scott talked about a little bit. Others have mentioned it as well. There's a number of programs in there for our industry. And while the 501c6 is still an issue that you're very familiar with, there are many benefits out there, particularly for our private sector partners in the terms of the Triple P program, which is payroll protection program, as well as economic injury disaster loans through the SBA. Lastly, we're in the initial stages of a recovery plan for the state. And much like you said, Bill, when the timing is right, we'll certainly release that. For now, we're just using inspirational messages right now through social media just to talk everything from recipes to the weather, but not a call to action to come visit. But we'll be ready when the time comes. Barring any questions, that concludes my report, Bill.
Thank you very much, Dwayne, and thank you for the work you continue to do on behalf of tourism. I'll just give a brief Hilton Head Island-Bluffton update as far as hotels. Right now, we have an occupancy on the island of 5.1% for all of our hotels. That's 5.1%, which amounts to 212 guests. To put that in perspective, last year at this time, we would have had an occupancy roughly of 67% and about 5,500 guests on the island. I'll run through the resorts that are closed, and as of yesterday that we have, the Omni Resort is closed, Sonesta Resort, Inn and Club at Harbor Town, Palmyra Hotel and Suites, the Days Inn, Montage Palmetto Bluff, Disney Resort, as well as the Spinnaker Resorts. And so there was discussion last night, an ordinance that was passed regarding hotel, home, and villa that is currently being sorted out, and maybe our mayor and town manager will have more of an update on that. But Dwayne, thank you for joining us, and we're going to move on to our next speaker, and hopefully we have Fred Green on the phone. Fred is with the South Carolina Bankers Association. Fred was a banker back here on Hilton Head Island in the early 1990s, was a terrific leader, a terrific banker. And Fred, it's great to have you on the call today, and it's been so many years since I've seen you, but welcome to the call.
Bill, thank you. Thank you for inviting me to participate. Enjoy hearing your voice and miss seeing you. In my career in banking, I guess we moved around about 8 times, and the tour duty that we had on Hilton Head in the late 80s, early 90s was our favorite of all the 8 places we lived. So I miss Hilton Head as well. Let me thank Senator Scott, if he's still on the line, he and his colleagues for passing this important legislation signed by the president just 12 days ago. It's going to do a lot to help basically the entire United States. So Senator Scott talked about the PPE program, and I'm going to add a little color to that and talk about the role that the banks play in that. So banks are basically asked to be the conduit for distribution of these funds. They're the go-between for their small business customers and ultimately the SBA. Just again, a little background. Treasury, United States Treasury released the rules and the application form for this program just last week. And the portal that was set up and to handle these applications just went live last Friday, so just 5 days ago. Back up a little bit. Every single application taken by every single bank for every single small business client has to go through this one portal at the SBA. That portal last year had on average $2 billion per month in volume, and with this $350 billion hoping to go out in 2 weeks, you can understand the initial issues in terms of the tremendous level of volume relative to the pipeline. So Friday was choppy, very little apps got in. Took a long time for those that did get in, hours for one app. The SBA folks worked over the weekend, probably 24 hours a day to increase the bandwidth, and over the weekend, more applications were processed. I'm proud as I can be for our banks in South Carolina. I think everyone had a shop of folks working 24 hours trying to process apps, get their customer information and application to this through this portal so that they could go to the next step. So that's where we were up to this point. The numbers that you hear, Senator Scott quoted a number. President Trump yesterday quoted 70 billion in dollars. I've got to let everybody know that 70 billion is not loan proceeds from this, but is 70 billion in applications approved and the dollar set aside ultimately for the loan to be closed and the check to be issued. So let's talk next step. Again, the applications are still coming in. They're being processed at a higher rate. Those applications that have been approved, now the banks are going to the loan closing part of that same SBA portal. The note from the SBA that small business customers would sign was just released last night. So the process of closing these loans and funding these loans really just start today. So you've got 2 issues on your bank. You've got those customers that continue to come in and those customers that have been approved and having to go back through that portal to be able to process those loans and distribute the checks to their small business customers. Again, it's an allocation process that everybody's working hard to get through. I do think that as the days continue to flow by, there will be more of these applications processed and more notes signed and checks distributed, probably more and more every day. Again, the 70 billion is out of 350 billion. I would advise all small businesses not to panic. Your banks are there to help you with this process. They've got an issue they've got to go through in terms of the working with the SBA portal. Congress is working on a second tranche, 250 billion. So again, I think at this point there should be plenty of money and no need to rush. And I guess what I would ask all of the small business bank customers to do is just be patient. Your banks are working as hard as they can. The folks on the SBA are also working as hard as they can. I think there's a representative on the call later. And Bill, I want to again thank you for allowing me to participate this morning and be happy to answer any questions.
Fred, we're delighted to have you on, and thank you for the fine work, your leadership at the South Carolina Bankers Association. And I can tell you that we'll probably be, not probably, but we'll be reaching out to you again to join another one of our calls. So thank you for that great update.
Thank you.
Next, we'll move on to William Furman. William is the area director for the SBA, South Carolina SBA, and William and Hannah Horn on our staff and SCORE did a webinar yesterday. I think we had close to 300 people that had registered for it. William, we'll turn it over to you for an update.
Excuse me. Thank you so much, Bill. It's good to be here. You know, we did have a really good webinar, I thought, yesterday. I think we conveyed the information on both the Economic Injury Disaster Loan, or EIDL as I call it, and the Paycheck Protection Program, or PPP as it's called. I think we hopefully we got the message across on that. Fred Green, I just want to thank you and all of the bankers that are working very hard. You know, here at SBA on the local level, the district office, I can tell you we were working over the weekend side by side with your lenders, and so you know we're all pulling really hard to get this thing up and off the ground and running. You know, had somebody in Washington yesterday that made the statement that this program is like an airplane, you know, that we're constructing while we're in the air, and there's some truth to that. And every day, I think it gets a little bit better. You know, we've had a few bumps, but the plane is still in the air. That's the good news. So, but with that, I'll try to be somewhat brief. We did. It's been again a very busy week here at SBA. We started taking the PPP loans last Friday. This Friday, we will start taking those PP loans for independent contractors and the self-employed. And so that was kind of done in two phases. It started with businesses last Friday, and then independent contractors and self-employed this Friday. We're still getting a large demand for the economic injury disaster loans. We're still seeing a lot of people that are signing up for that. One thing that I do want to bring to everyone's attention is that we don't have the ability here in the district office to give a status update on those EIDL loans. And so they would need to call the SBA Customer Service Center for that information. And that number is 1-800-659-2955. Again, that's 1-800-659-2955. You can call that number, and the representatives there should be able to give a status on the EIDL loans. Now, you can also email that question at, let's see, here we go, at Disaster Customer Service at SBA.gov. So that's some key information there. Everybody's throwing out numbers on the PPP loans. Just to give you some idea, yesterday at 4 p.m., I got the information that SBA had done over 286,000 loans for $76 billion. And that is nationwide. One thing that has come out of this is that some businesses are having difficulty finding a lender that is willing to participate with them on the PPP program. As Fred said, lenders are the conduit, so it's essential that you have a lender to work with. And for those businesses that are having difficulty with that, I would encourage them to go to SBA.gov/SC, and they can get a list of all the SBA active lenders there. If you go to that page, it is at the bottom of the page. Let's see. I think I've covered that. Another bit of good news. And I don't think I talked about this last week, but for those businesses that have either an SBA 7A loan, an SBA 504 loan, or an SBA micro loan, SBA is granting payment relief on those. And starting with April payments, SBA is going to make the payment for that business on their SBA loan for the next 6 months. And so that's great news. If you have an SBA loan, you just need to reach out to your lender and coordinate that with them. And so that's, I think that will be most helpful as we move forward through this event. And then finally, I just, all of the information we have, everything I've talked about is located on the SBA website. If you just go to SBA.gov, you can find information on our EIDL loan. You can find information on our Paycheck Protection Program loans and additional information that will help you weather this event. So with that, if there are any questions, I'll be happy to take those at this time.
William, thank you. And this may be for you, or it could also be for Fred, either way. Does each bank get an allocation of funds, or is it first come, first serve across the board? Am I at a disadvantage because my smaller regional bank through an SBA approved lender was not quite set up to handle this level of application? That comes to us from Rachel.
Let me jump in, Bill. Fred Green again. First off, there is no allocation per bank, and it is on a first come, first serve to, again, through that portal. And I'm going to touch on something else real quick too, but so every bank, well, let me back up. Of the 70 banks in South Carolina, 60 some are processing customer applications. Those that aren't are extremely small banks and have limited resources to be able to do it. So for the most part, every bank is participating. Those banks are, as applications come in, I think most are working on a date time stamp. So they're not picking and choosing best clients. They're just taking those apps on when they were received and processing them as quickly as possible. Another thing I'm going to just jump on, and Senator Scott mentioned, and as part of your question, is the customer, non-customer issue for a bank. There's federal laws called Bank Secrecy Act, Know Your Customer, that requires banks to do a lot of research and reporting on every account that they open. So those accounts that are already with a bank, that bank does not have to slow down the process of running that filter. They can process those more quickly. So is probably an issue that because of the high flow of applications coming in, the narrow pipe that it has to go through to be processed, the banks right now are doing all they can to handle their existing customers without having to probably go back and go through that Bank Secrecy Act, Know Your Customer screen that's required under FinCEN.
Thank you,
Hopefully
Fred.
that answers your question.
Yes, good. We have another question from Linda. With idle, if you have a confirmation number but haven't heard anything, should you be worried?
Yeah, so that's a good question. We're getting that question quite often. If you have a confirmation number, I would not be worried. You can call the customer service, call or email customer service. But keep in mind, this was the first program that was rolled out. This is our typical SBA disaster loan program. They are overwhelmed. You know, every business in the nation has applied for EIDL for the most part. And so you can imagine the volume of applications that they have there. So you should be in good shape. But if you're really concerned, yeah, go ahead and call customer service, and they should be able to give you a status.
Thank you, William. With that, we think we'll move on to our next speaker. And thank you, Fred and William, both for joining today. I'd like to move on to Dr. Frank Rodriguez. Dr. Rodriguez is the superintendent with the Beaufort County School District. Dr. Rodriguez.
Thank you, Bill. Appreciate you having me on. And just to share with everybody, we are continuing our online learning opportunities for our students. We are additionally have the learning packets that we provide to students, but we have taken some measures to try to make that as digital as possible by increasing some of the span of the internet access from our building and 12 of our locations onto the parking lot area, so that our students might be able to, or their parents, bring them and pull up, stop at the place without even having to get out of their vehicle, download the learning packet, upload the learning packet that they completed, and that way we're trying to keep it as digital as possible. There are still some needs for manual learning packets, and we have a mechanism for that that we're utilizing. Also, if you recall, Hargray, I know, had participated providing free online access for free internet access for new customers, I believe it was. And so that's been helpful for many of our families. Guidance is rolling in regarding operational matters from the Department of Education, such as how to handle student grades during this time and other matters like that. On the meal distribution site, because we are continuing to meet our student needs. Many of them count on these meals on a regular basis, on a daily basis. And we're now averaging over 8,500 meals per day that we are distributing. That number grows every day. So I think that's just an indication of probably the economic situation for many families as we're moving through this. We will continue to provide those meals next week, which is our spring break week, and we will continue to do that. So that's an important piece. We are closed until April 30th in terms of physical closure of our facilities. But as we approach that date, I'm sure the governor will decide, how we proceed from there. Additionally, we're going to really begin our communication with families. I heard the conversation about the census earlier on the call, and that's something that is important to us as well. So we will also begin to communicate that with our families during our regular communications. So that's all I have for you today, and I appreciate the opportunity. I'll take any questions.
Dr. Rodriguez, thank you. And we continue to hear shout outs regarding Hargray as well. And that service that they provided has really been very, very positive. And so we appreciate your leadership, Dr. Rodriguez, and look forward to having you join us again.
Thank you.
You're welcome. Next, we'll move on to the chairman of Beaufort County Council, Joe Passman. Joe?
Good morning, Bill and everyone. Let me fill you in on what's happening in the county. Like everybody else, as you know, we're practicing social distancing. Many of our offices are closed. We're doing things online. We're doing things differently. Our county meetings are going to be held virtually, and I'll talk about that in a moment. But we're still serving the citizens and businesses as best we possibly can. One example, our auditor has just announced that We here in Beaufort County are going to follow the guidance from the South Carolina Department of Revenue. The deadlines have been extended for the business personal property returns for furniture, fixtures, equipment, and rentals. They're now due June 1st. Motor vehicle bills are being sent out as normal, but the South Carolina DMV has waived all late fees for non-commercial vehicles for registrations that expire in March through May. They're now due July 1st. And watercraft and motor bills that are not documented vessels are now due in May. Those will be extended to June, and those in June will be extended to July. So we're trying to do everything we can to be as normal as we possibly can. One of the things that I'd like to reiterate is what Dr. Billette had said and what Jeremy followed up on, and that is the social distancing. We know it works. We know if you wash your hands, if you have to go out and you wear gloves and a mask, you are protecting not only yourself, but other people. And we don't want you to be a statistics. We're very concerned about our first responders, our doctors, our nurses. They're doing everything they can to make us safe, so we have to do everything we can to make them safe. Tomorrow, we're going to start our budget process. We're going to have a virtual meeting using WebEx starting at 9 a.m. where we're going to begin the process of discussing the budget. Like any other business, we have 1,300 employees here in Beaufort County. We're trying to keep them employed as long as we possibly can. We're going to take a look at our revenue stream for the remainder of the year to see what we have to do and what decisions we have to make for the remainder of the year and what next year is going to look like. So that's all the news that's there. Oh, by the way, there is one thing that I'm going to plug, and that is an app that we have called My Beaufort County. That's where you can register all of your properties and your vehicles, and you can skip the lines at motor vehicle and pay everything online. You can do it using a credit card or your bank account, and it works very well. So I'll take any questions. Thanks, Bill, for letting me participate.
Chairman Passman, thank you very much for that informative update. We appreciate that. Let's move down next to Mayor Lisa Salka, Mayor of Town of Bluffton, as well as Mark Orlando, or Town Manager of Bluffton. Mayor Salka, welcome.
Good morning, everybody. Sorry, I'm on a call with the Municipal Association as well. Just a quick update. I'll ditto what everyone else has said about our rules we have to follow so we don't delay this phone call anymore. But I do want to give you a little update, then I'll pass it on to Mark. You know, we're following the rules and the orders of the governor, and that means we are enforcing social distancing. I think you're going to see we're not afraid to write citations after some warnings. We're very serious about it. I would give Bluffton, Town of Bluffton, an A, because for the most part, we have sheltered in place and all of the non-essential businesses have closed. Now we're just trying to take care of them so they can open when the day comes. We're sending out blogs and videos. Our Don Ryan Center, which is our business incubator, is working overtime to come up with ideas to help our businesses. And we'll work through our chamber, through some other local business on purpose and groups like that to really get that message out. We're the heart of the Low Country, as you can see in my banner. We put this banner up last week at the four-way stop. Used to be there years ago, and we just reincorporated it. But our heart of the Low Country, really, they're hearts of the Low Country in many ways. And we have many hearts given back to everyone. I've been trying to give out tips. I'll end with this and I'll give it to Mark. You know, I'm reading a lot more, and I did a little Google search and I found one of our hearts of the Low Country, which is Senator Scott. If he's still on the phone, I hope he is. He truly is a heart of our Low Country. And he's putting out a book, walking and chewing gum at the same time. But his tagline is how hard work, community, and business can improve lives and end poverty. And I will tell you, that's everyone on this call. And he has really written about all of us, because we are going to end poverty, but we are most importantly going to improve lives through all of this. So I just ordered it. I think it's a great read, and I think he's an amazing senator that is always there for us. So shameless plug on the town of Bluffton's part, but as I did before, Mark, I'm throwing the ball to you. Catch. Good job.
Good morning, everybody. Thank you, Mayor Salka. It's always great to be on the call with you and everybody, Bill. For time's sake, I'm just going to echo a lot of what Mayor just said. We are definitely focused on keeping people safe, and that means staff in our community. Our police department absolutely is educating, warning, and enforcing the governor's orders, especially social distancing. And our Don Ryan Center is building a business concierge and small business assistance program. And I want to give a shout out and a big thank you to Hannah Horn, who's definitely a black belt in being resourceful and helping all of us. More to come on that. I know that program will build over time, but our goal is to identify federal, state, regional, and local help. And whatever that means, it's evolving by the day, it's evolving by the week. We remain open for business. 100% of our services, with the exception of municipal court, although we're still accepting payments, everything is being done. More than 50% of our folks are working remote. And we have a council meeting on April 14th. Some good news on that is we're definitely focused on some emergency management matters, but also regular business. And so we are addressing regular business so that our community can stay focused and continue to move on. And I give a lot of credit to the team on this phone call and their entire region. So thank you.
Thank you, Mayor and Mark. We appreciate it, and we appreciate your leadership, and thank you for joining us again this morning. We'll move on now to the town of Hilton Head Island with Mayor McCann and Town Manager Steve Riley.
Good morning. Welcome to America's favorite island. Yesterday, our town council passed a short-term rental ordinance. But let me get into the important part. I want to thank the retailers on the island for passing self-policing themselves for the safety of our residents. Special thanks to Kroger's organization for setting the standard. I want to thank the PUDs, where the majority of our residents live, for reinforcing all the governor's orders so far. And I want to thank the Native Islander community for their input onto the problems and conditions of the island. And most important, I'd like to thank the staff of the town of Hilton Head Island, especially Carolyn Grant, for all the work that she's done in getting our message out along the way. And with that, I'd like to turn it over to Steve Riley.
Thank you, Mayor. So as the mayor mentioned, we had a council meeting yesterday. We passed an ordinance on short-term rentals. Our first task is going to be working on education for the rental agencies, and then we'll look at gentle persuasion as our first level of enforcement. Our fire and rescue staffing is still strong. We've been fortunate so far that we have not had exposures or other incidents that have hurt some other departments across the country. We do have plans if that were to happen, but thank God the efforts that we're taking are keeping our people safe right now. More and more of our staff is working from home. We are, as Joe Passman said, open for business, but the front door is closed. We keep looking, we got a little spirit team looking for things that we can do to kind of boost spirits and get our minds off of the bad news. So last Friday was Chalk the Walk and well received. We had some cards and stuff we did this week. But another new program, since kids can't have birthday parties anymore, is fire and rescue. When they've got a little time and you check in a couple of days ahead of time, fire and rescue will drive by your house, honk the horns, make a little noise, and wish you a happy birthday from a distance. So I hope folks will take advantage of those kind of things and share with us other good news, community outreach without actually getting out there and touching each other. We had this week, Monday, a spike in building permits. We continue to process permits. Frankly, if you're closed, now may be a really good time to get some improvements done and ready, because this will come to an end. We will reopen, and let's put our best face forward. In that same vein, you probably, if you've been on the roads at all, know that we're continuing to work in the Shelter Cove area. This time of year, normally traffic volumes are such that we would be required to do a lot of the work we have left to do at night. But given the significant drop in traffic volumes, DOT has given us a waiver that will allow us to continue to work in the daytime. That's faster work and that's safer work for the crews. And I'll finish up by just asking the question I keep asking people. Have you supported your favorite charity today? That's all I've got. Thanks.
Thank you, Mayor and Steve. We have a question for you all that comes from Richie. And that question is, in all town ordinances, he has seen a enforcement mechanism in that and was inquiring what that enforcement mechanism will be for the town's newest ordinance.
That's education and gentle persuasion at this point. I'm sorry, Bill, did you hear that answer? Okay. I think we've locked.
I did. Thank you. I did. Next question is from Danny. And why did the council choose 60 days for the ordinance instead of looking at 30 and then maybe addressing it for another 30 if needed?
I don't know that I have a good answer to that. That is the maximum time of an emergency ordinance. The drafter of the motion or the ordinance, I think, just went with that. And I don't know if there's any more I can add at this point.
Okay. Mayor, any comment on that?
He's absolutely right.
Okay. Let me just, I'm not seeing any other questions. Yes, I can. One more question. Sorry. This one's coming in from Gary, and it says, can the mayor or Mr. Riley expand the definition of short-term rentals?
The ordinance has been posted online, I believe, or will be very short. Actually, I know that if you go to our agenda package from yesterday's meeting, which is on our meetings tab, that the ordinance itself is at the bottom. I don't have it in front of me at this moment, but the definition is included in that ordinance.
All right, and one last question relates to the outdoor burn ban, and why do we have the outdoor burn ban in place now?
The state has issued a statewide burn ban, and we are following suit. We are reinforcing the state ban.
Good. Thank you for that answer and that clarification. And with that, I want to thank all of you for joining our call today. And remember, in a crisis, there are always two choices. We can allow it to overwhelm us and divide us, or we can allow it to be a reflection of our finest hour. And let's indeed make it our finest hour. Again, thank you for joining us. Reach out at any time. We are here for you, and we'll be answering any questions you have. Thank you again and have a great day.